Ultrasound business and financial advocacy. A legal disclaimer we put at the beginning of all of our presentations. Information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. This topic is really important because when you're talking about adding any service line to your practice or your department, particularly ultrasound procedures, you need to really do your due diligence to make sure, is it a viable option short-term, long-term? What is it going to cost to get it started? What is it going to cost each month? How is it going to improve patient safety? Is it going to attract more clients to your practice compared to the competitors? What are the regulations in your area? What are the different practitioners, sonographers, nurses within your team that you want to use the ultrasound machine? What are the scope of practice, the regulatory requirements, the insurance guidelines for reimbursement out there? You need to do a really good look at with whoever does your finances for your private practice, your hospital, your birth center, your home birth practice. What is the overall startup cost to get it? What's the maintaining? How much money could we potentially make? What are the procedure codes? Are we going to do a separate visit and do anatomy scans and 3D ultrasounds, or are we going to do point of care where it's added part of the management based on things they would have outsourced for and taken time to get answers to help with continuing the management? You need to look at the strengths and weaknesses of adding ultrasound to your practice. What's the timeline? How long is it going to take to get everybody trained, to get the billing implementation, to get the machine, to get the revenue back, to pay for it, the marketing campaigns? If you're adding a big service line and the sonographer is available a couple days a week, you need to think about all those. There's service and revenue benefits. There's improved outcomes, obviously, because you can get answers right away. If she's 9 weeks and you can't get the heartbeat with a Doppler, you can quickly determine viability, give some peace of mind, increase that next step for management decision versus waiting to send them out to an ultrasound department and wait for the answer. The ultrasound services are getting more and more busy, short-staffed, and it's a challenge to get some of those answers versus you can get them right away. If you're unsure with Leopold's maneuver, the baby's position, is it breech, is it heads down, you can easily grab the machine down the hallway and quickly, especially when they come in labor, make some decisions versus you're stressing and they could be delivering soon and you're not confident the position of the baby from a vaginal exam or Leopold. So there's certain situations where having a bedside ultrasound to be able to further assess your decision making, especially on the fly for can't feel the strings of an IUD and you've got to send them out versus you can just make the decision quickly if it's still in place or not. And you need to get them some backup birth control or it is there. And then just when they're ready to get the IUD removed, then you can worry about the strings in that situation. It's definitely an additional revenue stream if the practice is set it up right. You need to look at the different practitioners on your team and the scope of practice and what specific services each one of them is going to offer the machine. These are the steps for implementing ultrasound services. The traditional stage one, you do your due diligence, you determine the insurance reimbursement, the scope of practice, the budget analysis, the timeline of how long it would take to implement. And then stage two, you're like, okay, we're going to do this. We're going to start training the team. We're going to have workshops. We're going to do some online trainings, some in-person trainings. We have a seasoned person on our staff that's going to train everybody else. We're going to get some certain certifications. Maybe they're required for reimbursement. Maybe you just want to have a certain benchmark. Then the next stage, stage three, you're going to start making the policies, the protocols, the competency checklists, the documentation tools and templates, the scripts, helping with the billing team to get those systems into place, marketing that service expansion so that you can stand out from the competitors, especially if you're doing 3D ultrasounds and doing anatomy scans and having a sonographer in a couple days a week. You've just added a revenue stream versus just improving outcomes with the point of care side for the practitioners. Stage four is that final, you pick out your machine. Are you leasing? Are you renting? What do you get with it? Are you getting support? What type of probes do you need? What type of machine? Talking to the representatives to get a really good sense of what's best for your specialty and your needs. Meeting with the billing department to make sure there's accurate fee schedules. You've done your due diligence with the insurance companies and all the coding and modifiers and documentation that you need is in place and that your team is trained on how to charge and get those things reimbursed more easily and quickly. It's really, really important to understand every single professional scope of practice with ultrasounds based on the people on your team. Physicians have the most autonomy. They do the 20-week anatomy scans. They can pretty much do everything based on their specialty and skills. Physicians, assistants, nurse practitioners, midwives, They may or may not have in their state specific scope of practice written about ultrasounds, but there are guidelines with the various ultrasound organizations. ACNM, the American College of Nurse Midwives, has a specific scope of practice with ultrasound. Nurses have a little bit written in their scope. It's more based on training and what's being delegated to them from practitioners. And then sonographers, that's what they're trained in. That's their job, is to do those ultrasounds. The American Institute of Ultrasound and Medicine has the most comprehensive references and resources to go to when we talk about standards and guidelines for the accreditation of ultrasound practices within your service line, and those requirements based on medical staff performing, interpreting, safety guidelines, maintenance, caliber of equipment, reporting, the due diligence aspect of the services, the practice parameters, the guidelines, when is the point of care ultrasound appropriate to do, when should it be referred out to a sonographer, when should a physician do it versus an advanced care practitioner on the team or a nurse in triage. You need to really make sure you put good guidelines into place. And then the American College Nurse Midwife has a specific position of it's part of the standard practice of midwifery, but you need to make sure you get the training and education and demonstrate those core competencies. It's traditionally not part of the schooling. It's expected for you to get kind of like circumcision, first assist, ultrasound, or advanced skills that most people get on the job, or specific certifications as time goes on and they're practicing for a bit. You need to make sure you meet certain requirements, especially if it's an ARDMS facility, to be able to get insurance reimbursement. You need to make sure that your scope, your state guidelines, your insurance payer mixes, if there's certain rules and regs and expectations with codes and services and locations, and is it got to be supervised, collaborated, can it be billed independently by an advanced practice practitioner on your team? You need to know those things well. The nurse's scope of practice, it varies greatly based on, not really written on a state level, but just the hospital organization, the practices, job description, and their written protocols for the scope of practice and what things the nurses can be done and trained on with ultrasound. Understanding your state rules and regs, it's really, really important. I can't stress this enough, because there's too many times people think, oh, my competitor practice can bill for this and they get paid good money, so I'm going to implement it as well. And then come to find out they are collaborating with a physician and billing it under the physician versus you're an independent midwife, and that's different rules and regs with that payer mix. And so you need to make sure you understand the state regs, the individual reimbursement standards, and make sure you're doing your due diligence before you implement any service line. These are the different organizations that are really helpful with resources, training, support when it comes to regulatory guidance with ultrasound use. So ARDMS is a big one, AIUM, ACOG, ACNM. A1 has a little bit, and then rarely do I see midwifery and nursing state boards have anything specific to ultrasound. You want to budget appropriately for implementing this service and for maintaining this service. Do you want to become a one-stop shop place? Do you want to focus more on quality? Is it a revenue stream that you want to get? What's the average reimbursement for each of those billing procedure codes? How much is it going to take to train your staff, to maintain the certifications, the quality with the machines, the maintenance? Are you purchasing versus buying? Those are all things you really need to think about. When you're training your staff, do you have somebody on site local that can train everybody else? Are you going to send them down to the sonographer to practice with all day? Are you going to have them go to a training online? Are you going to have them go to a workshop? Are you going to bring in an expert instructor to your team to get everybody trained at once? Are you going to make yearly competencies? They have to do a minimum each year to be able to maintain that scope. Is it part of hospital privileges? Is it just part of the job description? You need to really have a good sense of how you're going to train your staff and maintain those high quality competency quality measures. There's different trainings and certifications that are out there for certain scopes and practices. You just have to do due diligence with your actual background and training and goals with the ultrasound. Creating clinical practice guidelines are really important. You need to have them around training and competencies and scope of practice and indications for use. How are we going to clean it? How are we going to maintain the machines? How are we going to collaborate? How are we going to transfer to higher risk care providers, whether it's an obstetrician or an MFM? Get pediatrician involved based on the findings of the ultrasound, documentation expectations, so that you're making sure for quality, risk reduction, billing expectations, that there's good scripts, there's good protocols within the EHR systems and the billing protocols. Competencies, you want to make sure that they can identify easily the different parts of the abdomen, pelvis, fetus. Being careful, 20-week anatomy scans are more for physicians. It's not part of this traditional scope of practice for advanced practice care providers. Point of care is specific to the management. So a fluid level, biophysical profile, gross anomalies, IUD location, dating, viability, cervical length, like very specific indications based on vaginal bleeding. You want to get the placenta location. You want to make sure there's no gross anomalies, that you're trying to do a heartbeat at 9 weeks with a Doppler and you want to make sure that the baby is viable. You want to do dating to confirm because they don't have an accurate last menstrual period, versus outsourcing and waiting. You can get the answers right away and help with your management decision. Documentation is important for any aspect of services. So put in policies, protocols. If you're doing a point of care testing for XYZ, everybody needs to document these things and note these things, whether it's on the image from the ultrasound and they're stored, certain calibrations are being collected, or it's just in the notes in the chart. You're going to need those for risk reduction. You're going to need them for communication with the team, and you're going to need them for billing purposes. Marketing the services, depending on what type of ultrasound you're going to do. If it's just strictly for improving outcomes and convenience, it may be a selling point of you being a one-stop shop compared to a competitor in the area. If you're deciding to do gender reveal, 3D, 4D, boutique services, I always just stress the scope of practice doesn't specifically advise on doing that because it's a risk benefit medical indication determination versus just fun seeing their baby. So you just have to look at, why are we implementing it? How are we going to promote it to the community? Is it for revenue? Is it going to be a fun additional service? Or is it going to just improve the outcomes and we're going to make a little money doing it at the same time? Purchasing versus renting, I stress enough, you need to talk to reps. A lot of people will do sonocytes, GE, Clarius, more mobile community-based midwives do the butterfly. You want to be able to just look at the different machines. Do you need a transvaginal probe, transabdominal, or are you going to do a certain specialty? Do you have a budget in mind? You need to kind of get a sense of how soon you need the machine. Do you want used? Do you want refurbished? Do you want new? How high caliber? Is there a certain company you're more familiar with and used to at your other practice? Talk to other practitioners in the area, what they like. There's amazing sales representatives that can help with financing and really give you a good analysis of pros versus cons that other people are deciding, because you're looking at spending 10, 15, 20 grand initially, or you can rent for $300-400 a month and then it'll pay for itself quite quickly each month. Billing implementation, depending on how big or small your practice, is it cash? Is it going to be codes added to your fee schedules, making them accurate based on the overhead and charges and typical allowable amounts in your area? If you're in network, what is the typical reimbursement for that? Does it make sense based on your overhead, negotiating with the insurance companies to make sure you get the best payment for those procedure codes? Training your billing staff, training your practitioners to make sure that the codes are accurately put in the system and that the documentation represents the care that was rendered. So if there is an audit, you can make sure that the money is not taken away that you got paid for. I can't stress enough, even though you're doing ultrasounds and it's important for implementing for quality of care, every service line and everything you're doing has a cost, has a business component side to it. And if we don't think about that, whether we own our own private practice or we are working for a hospital or department, we have to show our financial value of this to the organization, of the services we're providing, and the justification of adding the overhead costs. We need to compensate for that with the quality metrics and the revenue side of the department and the practices. So you need to really look closely at the pros and cons of what is it going to cost to get it started, what is it going to cost to maintain it, how much money could we potentially make per procedure code, how long does each one take, is it a separate visit, is it being added to the already established visit, what are the weaknesses and strengths in your local area, and what are the competitors doing so you can stand out from the crowd.